we would like to close with a very positive message about the treatment that is happening here at the University of Michigan and certainly at other centers across the country. It's certainly my hope that the future will hold not only better treatments, but earlier diagnosis. My own work is in biomarker research and hoping to find better molecular tools to diagnose pancreatic cancer early.
So you know, obviously we're all clinicians and we're taking care of patients with pancreatic cancer. But a key thing we all do here is we do research, because that is part of our mission, being in an academic center. And I am extremely optimistic about where we're going with pancreatic cancer. There's now a very concerted effort to develop an early detection blood test. And I'm going to let Andy talk about some of his seminal work in that area. But what I can tell you is I actually think we now have the technologies to do early detection for pancreatic cancer. We just need to work collectively as a research community to accomplish that. I think we have a better understanding of the heterogeneity of cells within the cancer. They're not all the same, and I think we have better models and systems to develop more effective therapies. And we, as clinician scientists working with experts in making new drugs, are going to make that happen. I think there's just increased national awareness, especially with the new data, that pancreatic cancer is going to become the second leading cause of cancer death in the United States by 2020, unless we do something about it. So I'm very proud of the fact that we have not only the team here, but behind us we have about 50 different researchers working on trying to come up with the basic science solutions to this disease. And maybe I'll pass the baton to Andy, because I want him to talk a little bit about the work on early detection, because clearly, you know, that's where we need to go.
Yeah, I can say that there is no greater time in the history of cancer research that's more exciting. This is the most exciting time for pancreas cancer research up until now. And that's a result of a confluence of events. Over the past 10 to 20 years, we've seen an explosion in technologies that have yet to be applied to cancer diagnosis and cancer treatment. And now is a really exciting time to see all of this come together. And so that's what we're doing here at the University of Michigan. In Diane's laboratory, she's using cutting-edge techniques to try to identify susceptibilities in individual people's cancers, individual tumors. In our laboratory, we're using microfluidic technology to identify single molecules of DNA that may contain mutations that may tip us off as to whether or not a pancreas cancer is present in a patient, but we just can't detect it.
What about treatment? What's exciting? What's your dream? What's going to happen?
So, for sure, there are tons and tons of clinical trials that are available now that were never a possibility even 5 to 10 years ago. And we've been able to target not only certain upregulated cellular pathways in pancreatic cancer, but also specifically develop drugs that target stem cells. We have novel chemotherapy combinations that have already shown recently that have increased survival. So using those as backbone and the new biological agents that are coming up, I'm very, very optimistic that we'll be able to improve on the survival for our patients. We offer genetic evaluation for our folks, not only for the familial genes that can increase the risk, but also for the genomic alterations that exist inside their cancer tissue. We can target some of those genomic alterations through our phase 1 clinical trials that we have available over here. And our hope is by doing so, we'd be better able to select that sub-cohort of folks that have the driver or mutations to some degree, and by targeting, improve on the survival.
Almost like personalized medicine.
That's exactly what we're trying to deliver.
Yep. Absolutely, and that really is where treatment is today. With early diagnosis, we can catch patients with earlier stages of disease and really be able to tailor the treatments to each patient. As we had touched on before, there are some patients who have a real problem with local tumor, and that local tumor can stay there and fester for many years instead of spreading. And we need to be able to tell who those patients are so we can target them really heavily with concurrent chemotherapy and radiation if surgery is not an option. And nowadays, this is the technological age. Everybody has iPhones and this and that, and so it's a really exciting time for radiation. We take new advances from the automotive industry, biomedical engineering, nuclear physics, and electrical engineering. We really combine those into really advancing the way that we deliver radiation so we can really optimize the cancer control rate and also minimize the side effects of treatment, so that oftentimes now I tell patients the main side effects of some radiation treatments are inconvenience and boredom.
There is hope.
There is hope.